It says here on my sheet to do welcome and introductions. So welcome. I'm Oliver, the Mayor, and also the Chair of the ICP, obviously. I just thought it was worth kind of reflecting on some of the things that have happened since we last met, which have been that change obviously going on in the system. You mentioned remarked to me the other day that the pieces are all up in the air, and I think that is true to say. I probably feel like that in South Yorkshire, but further afield there are definitely pieces up in the air, and so we are in a period of significant change. But I think we are in a really good place because we're doing loads of good things and doing them really well. And I do think we're at the forefront of a significant change around how we deliver, particularly healthcare, and how we think about healthcare in this country. And I've been really pleased to see some of the noises coming out of government about their and the way they want to see change happen. And we are working with government closely, not just on the health space, but across devolution and how we want to see this country. Yesterday, talking about some of that, you might have seen that Andy Burnham has now taken on co-chairing responsibilities for his ICP lead. Others follow, but there are a number of other things going on besides education. That is a big deal, and that will set the framework for these conversations going forward as well. As disputing that they keep on saying to us that thank you. That will be a floor, not a ceiling. So that will be the opening salvo in those conversations about how we want devolution to progress. And it won't just be through the devolution white paper. There are a series of other conversations going on besides, with people like Louise Hay, who was here in Doncaster just on Friday, announcing their money, and I'll come into it in a second, but also things like the DWP's approach to Get Britain Working. So all of these things are big and important, and the framework for how we will be working going forward. But in South Yorkshire, we've done a number of things since we came together in mid-October. Not least South Yorkshire's first ever Health and Care Innovation Showcase, which I was proud to speak at just the other day. That was at the AWRC in Sheffield. It was a celebration of innovation and innovative practice in South Yorkshire, and there was a huge amount to talk about. I can't remember the figures off the top of my head, but I think, Gavin, you might have said kind of the number of people that kind of applied to be part of that versus the number of people that we could actually put on the showcase was incredible, wasn't it? It was just a brilliant thing to see. And that is how we're going to build and deliver our integrated care strategy. So it's brilliant to have those voices in the room. It showcased projects demonstrating the power of partnerships, Simca, local authorities, trust, voluntary and community and social enterprise organisations, Health Innovation Network, Integrated Care Board, etc. And is, I think, again, another kind of wayfinding point on the road to a better and bigger approach to health and how we do it in South Yorkshire, a different approach. On health and housing, we've commissioned some work there, which has come to fruition with the output of the health and housing roundtables and the summit starting to feed back into discussions to inform the next steps. We've got an item on the agenda today for consideration on that. And then, as I said earlier, Get Britain Working, which is a big, big step forward. So really, really pleased to see that and see that South Yorkshire is at the very forefront of that approach from the government. We've got 70,000 workless households in South Yorkshire, as I'm sure people around the table will know. The announcement and the money that we're going to get from that is I think, a recognition of our track record in this area. We've obviously had work in Win, the grant work we did there, but also working well now, but also the Pathways to Work Commission, which has been the basis for some of this work from the government. It's why Liz Kendall came to South Yorkshire for her first major speech as Secretary of State, and why we've been in these conversations with government since then is because of the Pathways to Work Commission and the way that has framed and shaped the thinking of government and what they want to do. So we do have now, I think, a massive opportunity to shift the dial on this, and that has to be the long-term goal. We can't just, as we all know, we all recognise and have recognised through our strategy, we can't just keep pumping money into the NHS and hoping to solve the problem of health through acute measures alone. We have to absolutely kind of take a whole system approach to this and look at the social determinants of health. Really, really important that we do that. I think that's been recognised by this government. It's been recognised by the 10-year plan, Lord Darzai's report. Frankly, it's been recognised for a number of years, but we actually had to get to a point where we're doing something about it, and I'm beginning to see the seeds of that in the way that this government are working, not just talking about it, but doing something about it, and we will reflect that back to them in the work that we do here in South Yorkshire and the work we want to do on a 10-year strategy for South Yorkshire itself as well. So really exciting times, I think. So we're really pleased to be kind of here to be able to talk about some of that today. Any declarations of interest?
I'm the Whole Exec Director at SYHA, so we are Simca's delivery partner for Workwell, and so declaring an interest in item 6.
Thank you. Any other declarations of interest? Okay, brilliant, thank you very much. Can we just agree the minutes of the last meeting? So we had the last meeting on the 15th of October. Anybody got any objections to that? Any changes? Brilliant. In terms of the action log, can we just get an update on the action log and where we are? Who's doing this? Action log.
There was one action this time that was with regard to Kathy McCarthy, if you remember,
Yes.
looking at how we allocate that going forward. So we're still working on that behind the scenes, and we've progressed the actions around the Creative Health Board and when some of that work comes back to the board. So that was the only one really to pick up today.
I see that Barnsley just appointed Kathy's successor, so that is good to see. And we wish Kathy well, despite the fact she left us. So can I just move on to item 4 then? But before I do that, can I just say we've received the following apologies for absence at the meeting. So Councillor Kane, Phil Holmes, Alexis Chappell, Damien Allen, David Crichton, Sheena McDonnell, Councillor Joanna Baker-Rogers, Ian Spicer, Jason Page and Richard Jenkins. Send apologies to the meeting. And today we have 4 members of the public attending the meeting, I believe online, I've got this right. Alex Reeks, Business Manager at Thorpe Medical Centre, Marjorie De Costa, Brew, and Shona Hawkins and Ellen Watson. And we have received 3 questions from one individual who's registered to attend the meeting. Have I got that right? Yep. Brilliant. Hello. Would you like, rather than me reading out your question, would you like to ask your question?
I think I'm going to ask it on my
I've volunteered,
Okay.
in addition to my reception duties, I've volunteered to read the questions as well. So it's broken down into 3, if that's okay. So obviously, Alex, who's the business manager at Thorpe Medical Centre in Sheffield. The questions relate to the Darcy report and the 10-year National Health Plan, and what Alex feels like is an omission. So the background to the first question is that the only sustainable solution to congestion in acute hospitals, for example, is to build up the capacity, capability and infrastructure and the technology base of care that is delivered in the community, including in general practice, community services and mental health services, and by keeping people well for longer, they're less likely to need hospital treatment. So the first question is, should the ICP request that the report be amended to include that point?
Do you want to just do all 3 and we'll take
Yeah,
all
of course. So question 2 is slightly longer. So Alex's practice have demonstrated our systems can be adapted to reduce the risk of misdiagnoses, how data can be used to identify patients who've missed diagnoses to get preventive treatment programs, how their data sets can be used to identify patients at risk of things like diabetes, CVD, dialysis, and other matters, general practice league tables for A&E presentation, and general practice league tables for admissions. And then, so the second question is, should the ICP encourage the ICB to understand that these opportunities before developing a response and contributing to the NEY ICB response to the 10-year plan? And then the third element is that Alex suggests that at the last 2 ICB board meetings that there hasn't been a mention of general practice. So the question is, given that general practice forms part of the only sustainable solution to congestion in acute hospitals, according to Lord Darcy, should the ICP encourage the ICB to give general practice and specifically the opportunities identified in that second question I just outlined more focus moving forward?
Okay, thank you. What I'll do is actually I might just ask Gavin to answer those questions first off, and then I'll come in on the back of that if that's okay.
Perfect. So firstly, say hi Alex. Thanks for coming in person. I think they're really excellent questions actually, and I suppose just on the record, we're happy to be encouraged, but I think we're actually quite active in this space. So a couple of things to say just off the bat. If you think about the analysis in Darcy and the 3 shifts that the government are talking about making, so hospital to community and digital, so analog to digital and treatment to prevention, I actually think the questions speak really well to those three shifts. So I think the first thing to say is absolutely agree that primary care has an absolutely critical part to play in achieving, the change that we want to see, and is clearly so necessary as per Aradazi's report. So that's the first thing. In terms of responding to your questions, what we will do is we'll produce a written response and we'll publish that and make it available to you. So that's just, I guess, for the record. But I think more importantly, it'd be good to meet with yourself, Alex, and maybe a couple of members of my team. So my lead for primary care and my digital lead, because I think your middle question particularly speaks to digital. So I was going to kind of offer that. Just to respond to the specific question. So first of all, the question around what did primary care was primary care covered sufficiently well in the paper that went to the ICB board on the 6th of November? I think just to be clear, that paper was not our response to Darcy. That paper really set out the process by which we would produce that response. So it didn't really speak to, what should hospitals do? What should mental health organisations do? What should primary care do? That wasn't the purpose of the paper. But the response that we submit as part of the national consultation around the plan will certainly include a focus on primary care. And in fact, last week we had a strategy event with health leaders, and part of the focus of that was developing our thinking in order to be able to respond to the consultation. And we had a GP voices there, particularly through the Primary Care Alliance, and we had a presentation, etc. One of the critical actions that came out of it actually was that we would convene an event in January, which is much more broad in terms of who's involved in that. So certainly primary care, general medical services, but also dentistry, optometry, community pharmacy, the VCSE sector, and others, to really think through what is our model for neighbourhood health to respond to the 3 shifts and Darcy. So it's just to kind of reassure you that the paper you saw on the 6th, that wasn't it. That was really describing the process as opposed to the content. Your points around digital and data, I think, are really important. It's interesting, that innovation event that you mentioned, Don, we had a couple of really good examples of how we're using kind of decision to support tools around things like cancer. So you probably come across the See the Signs tool that we're using. So I think digital in the context of primary care is absolutely critical. I mean, I know you're doing some really good work in this at Upperthorpe. So I think this is why I'd quite like to have a more detailed conversation with Kieran to make sure we're playing those ideas into our thinking. But just to say, I think, think about the shifts. I think that's really, really important. And then I think the final question, I think I've probably already answered it, which is what arrangements we're putting in place to hear more from primary care in terms of it's not just their contribution to the delivery of the shifts, but it's also some of the challenges and obstacles that get in the way. I haven't mentioned it, but one of the things we are doing is we're one of the national pilots around PC. I think you'll know this, Alex. But I think there are 22 national pilots, and there are 4 in South Yorkshire. So basically, what we're trying to do is to test out new approaches and new models that hopefully have benefit for wider primary care, and actually do pick up some of the points you make around digital and data, but are also around how might we, develop, I guess, a different model. Because I think there are huge challenges facing primary care. So sorry, that's a bit of a long answer, but I think there's a lot in your questions. I think they're the right questions, and what I would suggest is we spend some time and talk them through.
Well, let me just add to that, which is, I mean, I agree with everything that's just been said, but just to reassure you, I mean, we can't solve the health challenges in South Yorkshire without GPs. I mean, it's just as simple as that, isn't it? So, I hope that is a reassuring statement. We have to obviously work with the government to make sure that the funding is right, the model is right, and that we're working with you appropriately. But there are things we can do in South Yorkshire, and we should do those things. So, really appreciate you kind of making the case, but we are on your side and need to work with you. Gavin's absolutely right. On things like cancer, I mean, I'm just a huge advocate of how we use data to better solve some of those challenges, but that can go right across the piece on everything from diabetes, musculoskeletal, all the big things that are going to essentially bankrupt the NHS if we're not careful, are the problems that can be solved by data, and most importantly, we can help people. So that is fundamentally important. In South Yorkshire, you'll know we've got, for instance, like the Beds for Baby scheme now. And we are delivering that in no small part through GPs. So kind of wherever possible, we have to absolutely kind of work with GPs. If there's anything you think I can do in terms of kind of making those representations to colleagues, if there is a meeting I can come to, a conversation I can have en masse with GP colleagues across South Yorkshire, please do let me know, because I'd love to be able to do that and kind of come and have that conversation about what you see as the challenges, but also the opportunities in South Yorkshire to do this better and do this differently. Not just because I'd be interested in that in relation to this job, but more broadly across South Yorkshire in my role as mayor, and then also kind of in terms of my conversation with government, how we can absolutely kind of like reflect our concerns and opportunities in South Yorkshire back up the chain to government, so we can make sure that the whole system is responding appropriately to what it is that you want to do and do in South Yorkshire so well. So thank you for the work that you do. Thanks for coming here today, and I hope that answered your questions. Thank you very much. You're more than welcome to stay for obviously kind of the whole meeting. And brilliant, wonderful. Okay, thank you very much. Okay, on to the rest of the agenda in that case. So today we have a focus on our bold ambition to controversially work together to increase economic participation and support a fair, inclusive and sustainable economy, which I hope we all agree with. So item number 5 is the South Yorkshire Housing and Health Summit report and next steps, please, from supposedly Greg, who I can't see. If not, Nick is in charge.
It is. Greg's delayed on the transport system. So thanks
for that transport system.
it's the rail.
I stand by my.
Thanks very much for inviting us along today. Just as a way of brief introduction to the paper, HACT were commissioned by Simca at the beginning of this year. So Rebecca and Colin were integral in that to basically identify where there are opportunities at a regional level to collaborate. So it builds on, the report itself builds on the issues that were covered at the Housing and Health Summit, which you mentioned, Chair, in your introduction, which was at the end of September. And following the theme from the Innovation Conference, we also had to turn people away from this event as well. So it was really good to see the level of engagement, and that built on the momentum we'd created through the workshops that we'd had earlier in the year. The summit was very much set the scene by yourself, Chair, and you setting out your vision for the region, and particularly the radical changes that you want to see in terms of health outcomes for the population across the region. In terms of the attendees, there are over 50 senior strategic positions from within the ICB, public health, social care, as well as housing associations, local authorities and the VCA. So a really, really good level of representation. The report itself, as you can see, has 8 recommendations across 3 themes. And that's basically a bit of a route map really to set out the next steps that will enable housing and health and that early integration to continue to develop and flourish. So the report highlights some significant opportunities that could be realised from that, but we also appreciate there's a discussion that needs to be had around resources to develop some of those recommendations, particularly around a strategy or future work. It's important to know, and I would stress this, particularly having read some of the other papers on today's agenda, this isn't about replacing place-based initiatives, but it does seek to identify gaps across the region and where we can replicate good practice that's happening in one area to enable the quality of provision across the whole of the region. For those of you who don't know, the South Yorkshire Housing Partnership is made up of all the main housing providers across South Yorkshire, as well as the 4 local authorities, Simca and Homes England. And we've revised our priorities, and we now have a dedicated work stream which is focused on the delivery of healthy homes and homelessness, so making those clear links. That work stream is comprised of a range of people, so yes, housing providers, but also health professionals, including the ICB. Greg leads that work stream, public health and also adult social care. Just so you know, the South Yorkshire Housing Partnership has already adopted the report and its recommendations, and that will inform our future work plans, so a route through to actually starting to see this being delivered. In terms of outcomes from today, in addition to the recommendations in my covering report, I suppose it'd be also really helpful to understand how we maintain the conversation and the momentum that we've built up over the last 9 months, particularly between the ICP and the South Yorkshire Housing Partnership. And, you know, one of the proposals in the report that we come back at a future point that will be helpful for you to report on progress. And just before I sort of finish that, I thought it was really interesting when I was reviewing the pack for today's meeting. And there's several of the issues that you're considering that have a direct overlap with housing. And an example being the focus on children and young people having the best start to life, a warm, safe home and the skills to thrive. As a partnership, we're working really closely to reduce the use of temporary accommodation and focus on the prevention of homelessness. And well as that, providing support to tenants, often with complex needs, to maintain their tenancies so that they keep that roof over their head and the stability that provides for their life chances. That's also why we really welcome the mayoral homelessness task force and the potential implementation of a South Yorkshire Housing First approach as well. We've seen how well that's worked elsewhere. We've also got a sustained focus as a partnership on delivering a range of retrofit works to improve the energy efficiency, but more importantly, to reduce the cost of living in that home so that people no longer have to make the choice between heat and heat, particularly relevant on a day like today. So, Paul said you're happy to take any questions.
I'm minded, I've had a number of conversations in space, obviously not least being at the event. I was with the Design Council the other day, who were on a national visit to Park Hill to look at how design standards can play a role in solving some of these problems. I've had this conversation with Angela Rayner, who was on the call yesterday with Kate Barker, looking at the new town's proposal. Loads of work going on in this space, and we have to get it right, and not least because of obviously the health implications. So really appreciate it. Okay, I've got Angela wanting to come in, and Helen, and then I don't know if I've got people in the room also then wants to come in, please.
Thank you, Chair, and apologies for not being there in person. Greg is still in transit, hence the fact he's not there yet. And before I say what I want to say, I just realised I need to declare an interest in item 7, because I work for a voluntary sector organisation that occasionally gets funds from the NHS. So,
thank you.
So I work for Studio Sanctuary Sheffield, so I need to declare an interest in that, just in case. Thank you. Yeah, thank you for this item. Obviously, something that is extremely important. I'm glad to see that there is kind of some regional coordination. We had a conference in Sheffield last June 2023, I think it was. It might have been earlier than that. Very early in my tenure as the chair, you know, as the lead member for Adult Health and Social Care and the chair of the Health and Wellbeing Board, we made sure that housing was represented in the health space. So we have the lead member for housing on the Health and Wellbeing Board in Sheffield. Not sure how it works in other authorities, but we then organised a conference. And one thing that was very important that we keep talking about housing. And I think it's really important that in a health space, we think about a home, because having a roof over your head could be temporary accommodation, which is not a healthy place to be. A hotel room where you have no cooking facilities. You know, it's okay in an emergency, but not long term. And we know that people are stuck in temporary accommodation for a very long time, at least in Sheffield. I'm not sure about the other places. So I think it's really, really important that when we say housing, we mean a home. A home is somewhere where people feel safe, supported, it's healthy, there's no mold on their walls. And if there is something wrong with their health, and if they go to hospital, sending them back to a house that has made them sick in the first place, it's the wrong thing to do. So if we don't, you know, it's so important that we address the housing as long as we mean home. We don't mean just 4 walls for a person to be out of the elements. This is really, really important, because so much of the social housing and you know, private renting housing, especially in exempt accommodation, is in a really dreadful condition that doesn't allow people to lead healthy lives. So, you know, if we talk about prevention, that is so important that we all also look at solutions in terms of how we address, you know, the really horrible state some of our housing is in.
Thank you, Angela. Just for the record, I couldn't agree with you more about home versus house, but I would probably go further as well. And this is the conversation I was having with the design council, is about how do we build community? Because actually that kind of community wraparound, I'm sure you would agree, that community wraparound for people who have mental health issues, who have issues with isolation, loneliness, can't just be solved by their housing solution, and even not their home solution. It has to be the community solution. And we, I think, have a strong track record in South Yorkshire of building communities, but we can't take that for granted, and we need to make sure that our policy frameworks acknowledge the need to build communities and not expect them to be organic always. There are kind of things, there are policy frameworks that we need to kind of build in order to actively encourage community building, and we should pay more attention to that in my view. Helen, would you like to come in?
Thank you, thanks Chair, and thanks for the paper, and thanks for the event. It was a really good event, I attended it, and Oliver, you've preempted what I was going to say, so just building on what Angela was saying about homes, totally agree that actually what is really key is to ground this in the idea that, one, there's a principle that people should have a safe home and have a community that surrounds them, that are connected, there's their connections there. And with that in mind, I was just reflecting on, the action around social prescribing and setting social prescribing principles, because the conversation I was in was a really good discussion about actually social prescribing is quite limited in terms of how you can use that mechanism to connect people. And I do think that there's some opportunity here to really think about housing in the context of community building and supporting people to stay well. So kind of bringing prevention of people's needs into kind of broader conversation. So I think there's opportunity to do something with that, but in a kind of community building kind of framework.
Thank you, Helen. With impeccable timing for those online, Greg has just joined us.
If only the bear could control the straits, that's all I
I've already passed the book sufficiently, so that is always good. Greg, is there anything you, sorry, completely unfairly, is there anything you would like to add to the conversation?
No, I may come back later.
Okay. Is there anybody like to come in on the paper?
Other than say thank you to Nick and Rebecca, who did a lot of the hard work on it.
As just one of the key things that Drew summed up at the end of the summit was a catchphrase, safe place to return to. So there's something in there about duty to refer, which is often used in the housing context around homelessness, but there was something around working in clinical settings as well and other community settings to make sure, for example, if there's hospital discharge, asking that question, a bit like a safeguarding question, have we got a safe place to go home to?
Sorry, here's and then.
Yeah, just pick up what I point. I welcome you coming back. I think we've talked outside of this. Maybe we haven't had enough focus around housing. It's a really good opportunity, but actually, I think we should be having this conversation regularly as a part of the ICB, because it's a really important vehicle for how do we get our population healthy. Yeah. I don't think we've quite done. If I look back at it, I don't think we've quite done enough. So can we? Yes, I think we'd like to come back. We need to think about how we do that more readily. Sorry,
great. Thank you, Stephen.
Yeah. So this is a boring point to a very rich report, really, but it is about how we come back. And I suppose the question that's being posed in the report, and the thing that will be very helpful, will be to answer the question around how we're hardwiring the work of this board with the housing partnership, because I think that's going to be important. It's a governance point, Oliver, we talk about in the car, but governance is important in terms of doing this, because otherwise we'll lose some of the thread around this. The second point for me is coming back with a programme of work that we understand what the capacity and resourcing is that sits behind that, because otherwise this will be a great piece of work that we don't actually take forward. So answering those two questions for me are going to be quite critical when it comes back.
Any other comments?
I've opened my phone. I'll agree with all of that. There's a South Yorkshire versus place thing that's always in the mix there, all tenures, etc. And I presume we talked about the things that we didn't talk about the event, which were also important actually. And as Stephen said, the robustness of the arrangements to make it all work. It happens because willing people make it work. We actually don't have a programme manager for this piece of work, and it absolutely needs to dock into the South Yorkshire Housing Partnership, which is strategically really important for all sorts of other reasons too.
Any other comments? No? Okay, thank you. Thank you, Nick. So the ICP board are asked to note the discussion at the Housing and Health Summit and the recommendations on the follow-up draft report, and if one, consider the recommended next steps and consider the role the ICP can play in supporting those recommendations, and agree to future updates from the South Yorkshire Housing Partnership on any emerging delivery plan in relation to the draft report at Appendix 1. Any objections? No, there we go, sailed through. Wonderful. Thank you very much. Okay, on to item number 6, which is a focus on work and health, and that will be led by Fliss and Christine. So over to you.
Thanks, Chair. I hope you can hear me. It's Christine. I'm online, unfortunately not in the room. I had to come to London to talk about working with health and growth accelerators. So Fliss and I are going to do a bit of a double act on this. So we've got some slides which we just want to run through. So I'll start off, please. If we can just go to the next slide, please. So just to set out what Fliss and I are going to cover, really, there's a huge amount of work taking place across South Yorkshire in each of the 4 places relating to work and health. And what we want to try and do is set out some of the different elements today, highlight the strong strategic alignment between partners and wider stakeholders, and really what our collective ambition is for the future. So we're going to cover the items you can see there below in the presentation. So I'm going to hand to Fliss, who's going to talk about the Trailblazer and the white paper. If you go to the next slide, please.
Thank you. And as you could have tell by that introduction, we really haven't co-authored this as smoothly as we could have done. I've been out of the country actually for 2 days, and it's a paper has landed that I've been really looking forward to. And so I'm a little out of touch exactly what was the final content. But what we do know is that a space where both the ICB and Simca are really, really interested in is looking at how we can tackle economic inactivity within South Yorkshire. And the white paper and through the budget has given us some funding in this space, some really critical funding. So we have been selected as one of the economic inactivity trailblazers. So the Combined Authority will receive up to £10 million. And that will very much take forward the Pathways to Work ambition that Barnsley led and is now being rolled across all of South Yorkshire. But also within that same pot, within the same frame, is the fact that we've also managed to secure one of the growth accelerators, only 3 across the country, and absolutely brilliant for South Yorkshire. So we're hoping that we're going to have over the next financial year a funding envelope of about £18–19 million in this space. And as Christine said, if we go on to the next slide, please, this is totally aligned to both the Combined Authorities and also the ICB's strategic missions writ large. It's baked into both organisations. So I'm less familiar with this, but I will say I do know it's Bold Ambition 3, but it's not just Bold Ambition 3, it's across all of the ambitions, your bold ambitions. If we just go on to the next slide as well, please. Right at the heart of that is work and health. And, you know, if we're looking at our young people, when Oliver was saying a bit earlier, we know how many of their work families, if parents are not involved and not in work, then that has an impact on our young people. So work and health is absolutely integral to everything that we're doing, I think, in both structures. And if we go on to the next slide, please. Then within the skills strategy that was also launched this year, we can see our first mission area is to move those services from the labour market closer to work. And I think too often I talk about in terms of challenges, but I really want to flip this round and talk about how this is an opportunity. And I think if we just go into some of the data rather than focusing on any of the real context there, if we can go on to the next slide, please. I'm going to skip that actually, I'm going to come back to pathways. If we could just go on to some of the data, I think that would be helpful. We know, depending on what stats you use, I think it doesn't really matter, is the fact that it's a huge challenge for us. 1 in 4 of our working age population is economically inactive. That's huge, like absolutely huge. If you think about that in terms of your network of friends,
or in your communities, and if the majority of those people are in work, then there's going to be whole communities where there is nobody in work as well. So it's a huge challenge for us. But the majority of the people who are economically inactive is either due to long-term ill health conditions, whether that be mental or physical, or who have caring responsibilities. And so there's something that we need to do together as a system in this space to create the change that we need. So if we just go on to the next slide. And I think this is where we see that this isn't a national challenge at the same scale as what it is in South Yorkshire. So we know that unemployment in South Yorkshire on the whole is actually okay, but economic inactivity, the gap between the national average is huge. And so we need to do things differently. And I think if you look at each part of the system, and we will go into some more of the slides here, we all think we're doing an okay job, but we're not doing enough. So therefore, what do we need to do as a system to do more? We don't have a lot more money, we have a bit more money, but not a lot more money. So therefore, what is it that is our responsibility to change, to do things different, to make the size of change and impact that we need to do across the region? We're okay to go on to the next slide. We might just skim some of these. There again, we can see, as you probably already know, in terms of long-term sickness is a lot higher in South Yorkshire than what it is across the national average. Go again. These are graphics, we don't need to go into the detail. It just further confirms the level of challenge, opportunity that we have. Talking about MSK earlier, mental health challenges, it just shows that the areas where we need to focus on. And if we go on one more, please. And then I think it's fair to say, it's not just the Barnsley challenge, it's not just a Doncaster challenge, it's not just a Sheffield challenge, it's across all of our areas. And so therefore, whilst we might need to take more of a tailored approach within each of the local authorities, because there are different challenges. So the Pathways to Work Commission, of which I know that you've received a number of presentations, in Barnsley, ethnic minorities or cultural factors didn't really focus there because it's a different community. And so therefore, if you look at the likes of some places in Sheffield, we know that whilst a system change is required, we also need to make sure we're going right into the community as well to be able to engage with the people who need the support the most. If we go on to the next slide, sorry. Loads and loads of slides. Okay, if we go next. Herein lies the challenge. So whilst we might all think that we're doing okay in what we're doing, can we go back, sorry? Within each place, that is the number of commissioned services, all for our economically inactive who can touch on it. So I use this as a personal experience because I think sometimes when you relate it to a personal experience, it's helpful. My daughter has anorexia, and she dropped out of college, and the health system and the education system didn't work together to wrap around my daughter to keep her in college. And I feel like, and actually I will say this, and then I called up the local council where I live, and the only support they offered me, my daughter, was a course in coding over the summer. And I think I'm an educated person. My profession, day-to-day work in life is supporting people like my daughter, and yet I struggle to get the support I needed to keep her in education, and therein, how much harder is it for someone who doesn't know the system, who isn't educated, who doesn't have a network around them, to try and work out what support is right for them? And this is our challenge, or our opportunity, because there is money, there's lots of money in this system. It's not the money that's going to make a difference, it's how we work together that's going to make the difference for our communities. If we go on to the next slide. I really am passionate about this. I hope that comes across because I really feel that we can do something different. It's in all of our gifts to make this work for our residents. And you know, we don't get it easy in the fact that these are the number of different funding packages that we've been given by government. All of them have different output requirements. All of them are different lengths of time. Each of them follow different models. But what I'm trying to challenge ourselves within the combined authority, and which I hope we can do across the ITB as well, is say, shall we take on some of that risk? Shall we pull some of those funding streams together? Can we commission jointly, not just within the combined authority, but across the ICB? How do we do it so we can simplify the system for our residents? And therein lies some of the thinking and how we're going to take things forwards within Pathways to Work, which we're hoping that the Growth Accelerator and Trailblazer will form part of that. We go on to the next slide, please. I think we're nearly there. And that's just another slide. We can go on to the next one. Okay, so Pathways to Work. So I think you've received a number of presentations from Pathways to Work. I won't talk for much longer. This is where we're looking at how can we as commissioners work differently? How can we then at a regional level help navigate the system better? And then also look at one thing I think a lot of employment support programs don't help the employer. Do you know, everything's focused on the person, and employers, they're going for profit on the majority of the time. So how can we make it an attractive proposition for our employers to engage in a different way? The question that comes up time and time again is data. What can we do better with data? The more intelligence we have, the better we can be in designing services. And let's not forget prevention, because prevention is way better than cure, isn't it? So what can we do there? Next slide, please. There's a lot, sorry. If we just move on, we don't need to do that. I'm going to hand back over to
Do you want me to
Christy.
come in on this one? So Fliss has talked about the Trailblazer, and there are 3 systems across England that will have a health and growth accelerator, and South Yorkshire has been confirmed as one of those. This is, I believe, largely down to the strategic alignment, the strengths of and maturity of our system, and the fantastic work that we've been doing around Pathways to Work has given confidence that we will be able to make a difference in this space quite quickly. So the focus of the accelerator as part of the Trailblazer is to focus on those people that are economically inactive for health-related reasons, or indeed are at risk of becoming economically inactive. So there is a really strong prevention focus for this piece of work. So you can see there on Fliss's previous slide where this fits into that overall Trailblazer scenario. So what we're trying to do is work together as one piece of work to focus on where the health interventions will be to try and prevent people becoming economically inactive, as well as supporting those people who already are. So what we need to do is use that accelerator to make to inform the development of the 10-year health plan, and the learning from the work that we do will give government a better idea of how to develop this work for people across the whole country. Do you want me to just cover work well for this as well, because that was another element, and then we could take questions afterwards.
Go for it.
So, okay, so the other angle to this is we're also work well pilot, as you know, and myself and colleague Tina Slater from the MCA have presented to this committee before. So you know what work well is. Well, we have managed to commence that work in line. So can we move to the next slide, please? So this is just to update the integrated care partnership around what we've been doing. So the MCA have commissioned South Yorkshire Housing Association as the delivery provider for Workwell services. The delivery did commence on the 1st of October, which was in line with our requirements, but it's officially launched on the 6th of November. So we are planning further place-based engagement with communities, healthcare stakeholders and employers. Just to give you an update on performance, we have a total target of 3,750 participants. You can see there how that is broken down over the 2 years of the programme. You can also see that our first month's performance is behind our forecast, but the main reason for that is that the national requirement from DWP was not aligned to the 1st of October, it was the 6th of November, so that's caused us a bit of a slow start, but we're confident that we can proceed at pace. And we do have some successes already. If you could just move to the next slide, please, Mags. So we have had people accessing Work Well. We've had 12 people who have accessed the participant budget, and you can see there how that's broken down. And what we thought was just to try and bring it to life a bit, really, is just to provide a study. So this explains how participant A experienced sitting for long periods of time in a new job, negatively impacting on physical and mental health. They had personal challenges, including poor sleep, hygiene, lack of exercise, and vaping. And with support from the work and health coach, that participant has set themselves a primary goal, and that includes utilising self-care resources, managing vaping, and accessing local fitness. So this is how our whole person wrapping around those individuals can really start to help them get into a space where they're able to get back into work. So the next steps on Work Well is to make sure it's truly integrated within the health services, and we are seeking support through health and wellbeing committees to make sure that people are aware of the services, and we've got contacts into wider primary care networks to increase knowledge of the Work Well offer. And we're going to focus on wider communications and engagement with employers across South Yorkshire. So that's the end of our slides. So you can see there's a huge amount of work. There's lots of excitement and opportunity, particularly around the Trailblazer and the accelerator work. So I'll pause there, and Fliss and I can take any questions that you might have.
Thank you. Thanks both for the presentation. Just so some opening remarks from me. This is fundamentally important to South Yorkshire, like genuinely. I couldn't work out how to get an apprenticeship. So the real and as Alan Mill, 7 in 10 people failing those people. AI, so
Sorry to jump in, but none of us online can hear.
none of you online, or some of you online. Here online, raise your hand.
Very quiet now and very, very faint.
Okay, if I speak this loudly, is that better? Or is
It sounds like you're whispering.
Okay, we're trying to solve that problem. I could do this through the medium of mine. Nobody can hear you all. Might as well. Hey. AI, this is a possible technical support. Just have to give us 2 minutes. I don't want you to miss out on the pearls of wisdom.
I think we've got noise now. I have.
Is that better? If I talk at this level, how well can you hear me?
That's good. Oh, yeah, we can hear you. Yeah.
All right. I won't bother repeating. But, so just to say, we need to solve this problem. I just wanted to make a slightly broader political point, which is that I've been mayor now for 2.5 years and been doing this for 2.5 years. And one of the things that I'm acutely conscious of as I've gone through this system is the way in which the system or systems are set up to insulate politicians regularly from responsibility. So I think most obviously of the transport system, appropriately maybe, over years what politicians have done, and this hasn't always been, from a cynical perspective, but they have insulated themselves from the responsibility of actually the frontline service and the way it's delivered. And that has often been for good reason, because we want the systems to be able to kind of operate free of political control. But what it also does is free us up from responsibility for the problems and an ability to solve those problems when they appear in front of us. And sometimes that's because politicians love doing things, but they don't like stopping things. And yet I'm conscious that the result of that is the graphic that you showed us. We haven't stopped enough things. We've added things on constantly because we love adding things on. Someone comes up with a new idea, let's add it on. You've got a brilliant new scheme, let's add it on. You want to do something else, let's add it on. But actually, we don't often enough stop it. And I don't think we should stop things for the sake of stopping things. I'm not in the world of, one in, one out kind of bureaucracy kind of approaches and all that sort of thing. But we do need to work out how we better solve this problem, not just how we add more onto this solution and this system. Because if all we're going to do is add in the pathways to work on top of everything else, we're going to be back here in 5 years' time saying how complex the system is and we still haven't solved the problem. And at that point, we'll add something else into the system just to really help matters along. And we can't keep on doing that. So kind of that is a responsibility on people like me to be brave enough to stop funding things and say to people, we're going to actually change that mechanism, change that system, albeit well-meaning, albeit I'm sure helping some people, but clearly not doing what we need it to do, which is fundamentally changing how this system works and what people can actually do within that system to get back into work. So just that is a challenge to me personally, and I recognise that challenge. I'm going to go to the screen first, if you don't mind, Greg, but I want to come back to you. Angela, can I come to you, please, and then Helen?
Yes, thank you, and thank you so much for the presentation. I want to just pick on a point about employers, and I think there are two things here that we need to make happen. One is, how do we support employers to navigate the system that they feel is really complicated? So, for example, for a small employer in particular, if they think, oh, I have to make changes because this person has this medical condition, is disabled, whatever, it feels like a big ask, and they might think that it's really complicated and there is no support. So how do we make that simpler, and how we create an environment where employers, whatever the size, are supported in employing people that may need adjustments, whatever the adjustments are, because I think that is also important. To as partners, what are we doing? So as Sheffield City Council, as SIMCA, as NHS, at whichever level, what are we doing to support our staff when they are ill, particularly with mental health? And I get a dashboard every month of how many people are off in adult health and social care at any one time, and absence from work is a real problem, because obviously it has an impact on everything else. It's the same in the NHS, we know. So what are we doing to support our staff not to get, what are we doing to preventing staff getting ill? What kind of workspace, work environment do we create? How big are the workloads for our own staff? So I think we need to do our homework first, and then so all the pilots supporting people getting into work, inactive people, but what are we doing with people who actually are into work and are at risk of losing their jobs because they have been ill for a long time? I think that is also really important. That is prevention. And we need to do our own kind of looking at what we're doing as an organization. So what have we got in place to support people with their mental health? How do we avoid toxic workspaces? How do we ensure that the workload that we're putting onto people, we like to add extra. I think that is really important. Then how do we support the small and medium-sized employers in the region to, to understand how actually they can create healthy workspaces where people want to go, and how they can support the staff, and can we, as the big organization, put things in place where they can, refer their staff when they are not well enough in a supportive way, because you don't want to add to people's stress by making them jump hurdles. As some, I've had experience myself when I was a teacher, for example. I think it's really important that we really look at the employers and what we can do to support, but also what we are doing as employers, because things we can't just, ask other people to do it. We need to do it first.
Thank you, Angela. Helen.
Thank you, Chair, and thank you, Fran, for speaking on behalf of the screen people. I appreciate that. So I've got a few comments. I'll try and keep them brief because I know that there is a really helpful conversation between communities and FLIS and a range of other people. I think there are some key things there, just coming back to what you were saying, Oliver, about how do we make a difference? How do we just stop doing the same things? Really welcome bringing together investment. Having that bravery, I think, would be really good. We think about how do we just optimise what we're doing. I think we've got some really good examples and some really good understanding in some of the hyper-local models where the people who are kind of most out of reach in terms of opportunities, we've got really compelling examples of what's made a difference. And I think what can be an enabler is where we start to measure distance travel rather than kind of output type measures that I think are associated with quite a few of the national investment programmes. And also how we can sort of allow access and simplicity of access, and also the kind of overcome the fear of accessing this type of support by embedding community hubs. And we've got existing hyperlocal provision that could be connected into this. And I think just getting the kind of reach of it and the kind of connections to the sort of pre-entry type support would be really effective. Thank you.
Thank you, Kate.
Yeah, hi, sorry, I came off and came back on again because I thought it was just my laptop that was having problems with the sound, so I'm glad it was everybody else. So essentially, I've mentioned this last time on the health at work, was with regard to the route to volunteering. I really would like to see some stats on volunteering. I know it's not classed as economically inactive, but I really see that as a route into employment. So people that are coming back volunteering, I'm an employer as well with regard to unpaid carers. We see a lot of unpaid carers once they lose their loved one, they want a route back in, they become isolated, they've lost the skills, they want to come, they want to volunteer, and then they want to go into the employment world. So we're providing them with all those employment skills and putting them back in, but the route is via volunteering. So I really wanted to see that probably a little bit more, or maybe some stats. I'm sure it's something you're doing, but I don't see it necessarily reported on. And the other thing I just wanted to mention, obviously, in terms of the recruitment in health and social care at the moment, it's an absolute nightmare. So all those people that are economically inactive, we need to encourage them into employment. So if there is a route there, obviously from a small employer's point of view, national insurance is absolutely crippling our sector. So anything that we can do to encourage employers and to recruit into our sector is only going to be welcomed, really.
Thank you. Please, Christine, did you want to come back on any of that before I bring people in?
I'm happy. Sorry, I couldn't hear that, Oliver. I'm happy to come in on some of those points, but I couldn't hear if Liz was talking. Sorry.
So sorry. Well, Christine, why don't you come in first, and then we'll get Liz to.
Okay, thank you. I mean, just from my perspective, I mean, all of those points are really well heard, and I must provide assurance that they are absolutely fundamental in the thinking around both the Trailblazer and the Accelerator. We absolutely have a mission to join this up. We do want to be brave. We're trying to think about what a single governance structure and framework might look like for this, given the different elements at play here. And we are really trying hard to work locally across departments, but also influencing upwards to work locally together at government level. And that is happening much more, but it's how do we make that a reality on the ground. Really hearing you about unpaid carers, and we were talking about the difference between work and employment. How do we de-risk employment and for work for participants and for employers. So there's absolutely lots for us to look at, and this is why the Trailblazer and the Pathways to Work is so so critical, because it's got that employer activation side of it. You know, that's just really, really important. So I'll pause there though and hand back to the room, Oliver.
Thank you.
Yeah, a couple of points to add. So employers, I totally agree with your.
We can't hear you again.
Is that me? Can you hear me now?
Might just have to carry on, and if you don't mind, I'm sorry if it's frustrating. I'm not sure there's anything we can do to improve it. So we might just have to carry on. Hope that it improves. Is that okay? I'm really sorry for people who scream. But you'll carry on and try and speak loudly.
And then in terms of employers and engagement, and what Oliver said about what do we stop doing, that's something we're starting to look at. At the moment, I commission services, one of the skills advice, one front door for them, and let them be able to have one person who can navigate this. For individuals, no wrong front door, so that's work that we are trying to do. So yeah, I totally agree. Here, every point you make, we're very much looking at hyper-local commissioning, working with the BCS in each of the local authorities, making sure that people can engage with people like them rather than just people like me. So yeah, hear it.
Okay, I've got Craig and then I've got Nigel, and we've got 8 minutes left for this discussion.
Christine, thank you very much. Dead helpful. 5 quick thoughts, some of which you've picked up. I have many thoughts. How can I play? You may not want me to, but that's your call. How does this interface with mainstream services? I'm sort of well aware of the learning from working with it. Plonked over there, mainstream services, term used advisedly, didn't kind of play with it. There's something to do there. I was struck by the ecosystem thing and the sort of the getting the governance right at South Yorkshire and place level, and I don't know how well that works, so I think there's some thought to do there. Employers you've picked up, and SME sector, most people in employment are in SME sector, and the framing of all of the people who are in work, the bowl of bananas in the canteen versus toxic working environments, etc. That needs some thought. Occy Health, I would avoid award schemes at all costs, having run 1 or 2 over the years. And then lastly, you kind of skirted over that let's not forget prevention, because that matters more than anything. And sort of, I'd be just welcome a bit more thought on what that might look like. But we'll pick some of that out of the room.
Yeah, I mean, just to sort of like, I'm trying to project myself like a Shakespearean actor, a bit like Brian Blessed. I've always thought of Brian Blessed, yeah. So there's a couple of 2 points really. I mean, one of the first things I just want to bring up is how confident are you in terms of JCP referrals? Because we know JCP advisors have got a plethora of commission services that they can refer to. And we know that obviously in terms of October, your numbers are down. But when a client or a customer, as I call it now, comes to see a Job Centre Plus advisor, then we'll have a number of services to refer to. And it's about making sure that obviously you're on the radar to ensure that happens. And I'm just a bit concerned in terms of that link with Job Centre Plus and making sure that that's pretty robust. Second point I want to make, and it's been made before, and I've made it before at previous meetings, is about not necessarily the quick win, but the big win would be local authorities and NHS and care sector. And we know, and somebody mentioned holding up a mirror, and we know for a fact that we've got an awful lot of jobs effectively there at entry level that need filling. And to me, it's about upskilling existing staff, making sure that they've got qualifications on board and actually spending that money there, but also making sure that that releases more entry level positions within the organisations and actually saying, actually, we can refer into that. That takes wholesale change in terms of working with our human resource departments. But from me again, I've got to say, if you were to put in place a job guarantee programme where you take a client and you work with them from day one because they've been economically inactive, maybe they're not working, and you're working with them, you've got an element of training, you've got a placement there as well, you actually go through that process and you monitor them with a work coach over, say, 6 months, so they reach that level that they're competent, they've got the qualification. There's no reason why they can't walk into that job without an interview.
So it shouldn't just be a job interview programme, it should be a job guarantee programme. This has been done successfully before, particularly in Leeds with the Seacroft partnership. And the last point I want to make really is in terms of sort of like, when you look at what's been said prior, is when you look at volunteering and education and training, these clients are on a journey. So it may well be that they're not economically active at that point. But once they get a bite of education, a bit of, oh, I've got a qualification here, it's going to go on my CV, I've done that volunteer and I feel a bit more confident, you know that they're on that journey into employment. And that needs monitoring as well very closely, because they are wins and we need to be aware of them as organisations. But lastly, certainly NHS and local authorities should be leading this, because there's loads of jobs there, and if we crack that nut there, effectively we can deal with this.
Okay, thank you. I'm conscious of time. We've got 4 minutes left. Can I take Ruth briefly, please? And any last question? You've probably got one to have one more before Ruth. Listen, Christine.
It's a very brief point. I think for me, this is about fitting the support around the people rather than people into support. And like Greg said, it needs to connect in. So if somebody isn't economically inactive, they may have a plethora of other needs that we need to kind of support, and that leads into those pathways before they're even ready looking for jobs. So it's a difficult shift, but it feels like that's the thing. I think that's such an important point. We're just trying to adopt some principles at the MCA, and one of the principles is if people don't engage with us, that's our fault, not theirs. And I think on this in particular, if people aren't accessing these services, that's our fault, not theirs. Is a shift in our mental position, but I think it's a really fundamental shift we're going to have to try and embrace. It is on us to get this right, not them to engage with us on the basis of what we've already done. Any other final comments before we get responses from Christine? Fliss, can I bring you back in and then?
Yeah, okay, so I totally agree with you, Greg. This has to be mainstream. Pathways to work, a bit of funding, but this is about whole system change, of which everybody has to lean into and do things slightly different. And I think we've got the support and buy-in. But also, I think when we get down to it, there will be a bit of rub, and I think we've got to be brave to take that forward, because if this is just a little bit more funding, we're not going to make the difference that we need to. So we need to be brave and be prepared for that rub and let some things go and see how that goes forward. So totally agree. Prevention, all of the Growth Accelerator is on prevention. There is part of the Trailblazer that will focus on prevention as well. So very much integral. JCP, every week, all of the local authorities and representation from JCP are meeting together. We spend a whole day together in how we can start making this system change. So JCP totally baked into the design and what we're doing. And then just a final comment around skills. So I'm responsible for all of the adult education budget, devolved funding. We're starting to look at what do we do differently, rather than just fund qualifications. How can I fund around programme support, to therefore take things forward in a different way and see that as a journey. So totally agree with all the points, and yeah, we are starting to look at how we do things differently to meet this need.
Christine.
I'll just say a couple of things. This is about health, not illness, and it's about people, not conditions. And that's easy to say, but we're going to have to work super hard not to go to illness and not to have a focus on conditions, particularly on the health element of this. So that's not our learned behaviour. So I would, if we can hold on to health and hold on to this is about people and how we wrap around them, I think we'll get this right.
Bro, we've got a minute to spare. Has anyone got a minute's worth of wisdom that they want to throw into the mix at that point? Thank you. That was a brilliant discussion. Really appreciate the paper. Thank you very much. Okay, so all we're asked to do is to consider those ambitions and that paper. So thank you very much, everyone. We're now having a comfort break. We're back at 11:20. So we're back to talk about the voluntary sector and social enterprise alliance. Thank you very much.
So we're on to voluntary sector and social enterprise alliance, which is setting out our mandate to develop GCSE plan and the introducing of certificates for shares. So I think we're coming to you, are we? So do you want to go?
Yeah, sure. Thank you. So just to set up a bit of context, last time we came to the ICP in summer last year to give you an update about the GCSE alliance. I've got a presentation, or can colleagues see that in their packs? So, next slide, please. So, just to remind us, and a bit of the policy context, when the ICSs were being set, there was a clear mandate and a clear direction that the VCSE were a key strategic partner, and there was guidance in terms of how we support the VCSE integration as part of our ICSE. And I'm really pleased to say that our ICB adopted an approach where we specifically made space available for a VCSE partner member. The ICB has also ensured that we've got the VCSE voice around the table, and some of the work that we're doing in the Alliance is to ensure that actually across South Yorkshire, we're trying to embed and encourage VCSE participation within the system structures. More recently, the 24 planning guidance, there's an ask for us to develop a development plan in terms of how we plan to transform services, how we plan to work with the VCSE to do that. So specific ask in terms of producing that development plan, take us on that roadmap to do so. We've already heard people have talked about the data report, so we know that actually in terms of investment in community, looking at patient voice, and innovating in neighbourhoods, people have talked about community hubs, neighbourhoods, importance of people. That's in the data report. The VCSE absolutely is embedded within neighbourhoods. The 10-year plan in terms of the 3 shifts, all of them important, but we know from a VCSE perspective, treatment to prevention and the focus on prevention absolutely is what the VCSE is about. So next slide, please. Again, I don't want to sort of talk about all the different policies that are us, but we've got lots of different strategies in South Yorkshire. Very important ones, including the ICP strategy. You saw the slide earlier when we looked at the work and the work well work in terms of the different strategies. So the bold ambitions, very much all 4 of them speak to the work that the VCSE do. We've got the NHS Joint Board Plan. We've got the individual place plans, we've got the health and wellbeing plans and boards. And again, if you look at all the different aims and objectives of those plans, the VCSE absolutely are a key partner and a deliverer in terms of those outcomes. And we've certainly heard across the system leaders groups, there's absolutely a desire and a consensus wanting to work with the VCSE. Now, when we talk about the VCSE, next slide, please. We know that there's over 7,000 VCSE organisations, and we're not asking system leaders, we're not asking ICB to have the 7,000 organisations in one room and to try and support all those organisations. But my sense is talking to people that people know already in terms of the outcomes and the type of work the VCSE organisations. Over a third of our VCSE organisations are rooted in communities, in neighbourhoods. Nearly a third of them work across the whole authority area, and a third of them work over the wider geographic. In terms of economic value, nearly £700 million of economic value, and well over 16,000 employees. And well over 63,000 volunteers, and we know those are underestimates. Oliver, you talked earlier about the social determinants of health, and we know what they are, and absolutely it's the VCSE organisations embedded in communities who are supporting those. We talked about work and health and the relationship in terms of how important it is to have a good role. Kate talked earlier about volunteering. I know anecdotally hundreds of times that actually where we work with frontline organisations that take on volunteers, some volunteers are there for a long time, and some volunteers use volunteering as a pathway into employment and pathway into skills. So absolutely VCSE organisations support people in terms of their journey around work and health. But our ask today isn't about setting out the whole VCSE offer and asking, it's 2 particular issues that you outlined in terms of your introduction. So I'm going to hand over to Karen for our first kind of ask of the ICP.
Thanks, Jake. Hello, everyone. I'm going to chat a little bit about shared investment funds and potential opportunity around that. So a key role of the South Yorkshire BCSE Alliance is to identify opportunities for system collaboration to support shared outcomes. And in the context of the bold ambition to act differently together to strengthen and accelerate our focus on prevention and early identification, we think there's a potential national initiative that we want to highlight at the earliest possible opportunity for consideration. So the opportunity, the National Academy for Social Prescribing was funded last year to work up ideas for shared investment funds. Their final report is actually embargoed until the 11th of December, and so we can't share it just yet, but as soon as it's published, we'll share it as widely as possible, and then all partners can see the full detail of what it is that they're proposing. But we have been involved in conversations about this, and so we know kind of broadly the direction this is taking. And this is the statement that is publicly shareable at the moment. So in the report, they set out the rationale, design and steps required to establish a new strategic investment fund to unleash the power of social prescribing. The proposed £1 billion fund, 10-year shared investment fund is designed to incentivise long-term investment in the public, private and philanthropic sectors to build crucial social prescribing capacity. And they see that as a way to improve health and wellbeing outcomes, reduce inequalities, strengthen civic society, support economic growth and moderate avoidable demand on the NHS. I'm just going to say a little bit more about that. So the vision of shared investment funds is that it's bringing together funding from all sectors at a local level in order to leverage additional national funds into systems. It enables the creation of substantial and sustained funding that can be invested into the voluntary sector to support health in our communities. It offers a way to address an existing imbalance in social prescribing. What we've seen nationally and in many areas is a particular focus on funding the workforce that makes referrals into voluntary community organisations. We haven't seen similar funding everywhere to support those organisations to provide that vital support for people. So this would be a way to support the supply side of some of that work. And it might not stay with social prescribing over time, it might become a much bigger thing. And obviously the voluntary sector works in a much bigger context than social prescribing anyway. And they're thinking that this could be purposefully directed to help reduce inequalities. By considering this together at scale across an integrated care partnership, there is an opportunity to really create something that's attractive to the full breadth of local and national partners and investors to support shared outcomes. And there's an opportunity to co-create a vehicle that can scale funding that's available whilst being delivered in a way that meets partners' priorities and can offer equity. And for instance, thinking about how local communities, our places, our specific communities of geography, interest and health, those at risk of health inequalities. The national team that's leading this proposal is cognizant of systems that are already working in this space, and that includes South Yorkshire. And South Yorkshire is really well known for its innovations in social prescribing and wider work with the BCSE. As an example of innovation in social prescribing, Rotherham is still regarded nationally as a model of best practice. It was one of the earliest places to develop social prescribing. And just recently, it was cited in a national report that talked about the impact on health service use and costs, and found that the impact of social prescribing on frequent users of health services was a 33 to 40% reduction in non-elective inpatient spells and a 39 to 43% reduction in A&E attendances. And South Yorkshire as a whole is really well known for its work in green social prescribing, so connecting people to nature-based interventions to support mental health. And it's in that context that we've been engaged in the conversations nationally about shared investment funds. And we know that voluntary organisations are experiencing real challenge in terms of finance, in terms of high caseloads and complexity of caseloads, and a workforce that's feeling pressured. So this is a potentially really exciting opportunity for us to be thinking about together to invest in communities. And our ask around shared investment funds is to understand if there's an appetite right across the integrated care partnership to explore this at pace. We're ready and positioned for any opportunities that may be coming fairly soon. In order to be prepared and positioned for this kind of an opportunity, we'd need to be identifying the key partners who'd like to be involved in this. We'd like to understand where the investment opportunities and the relationships with some of the key partners, such as the private sector, would be. And we'd want to start thinking through fairly rapidly what a potential governance model and delivery vehicle for that fund might look like in a way that would work. Thank you.
So, hi, I'm Helen Sims. I'm the Chief Executive of Voluntary Action Shepherd and the Chair of the BCC Alliance. And I just wanted to talk a bit about a wider opportunity, which is to develop the BCSE plan. We've put out there the kind of ingredients of a plan, but I kind of wanted to pick up on some of the themes that we're talking about this morning and think about some of the framing. What is a BCSE plan? And it's a plan for transformation. But I think we might need to start our thinking around that work with a question. And I think the question is, how do we put people and communities at the centre of that transformation? And I feel that the BCSE as a sector has a great deal of capability that we need to recognise, value and support in that plan. So a lot of the language that we've used so far in our alliance together has been about the voluntary sector getting embedded in existing systems. And I think looking at this plan and creating some space to look at how we want to move forward, we want to invite system partners into BCSE space, actually, flip things around and change the dynamic a little bit. Come and have a look at the ecosystem that we've been describing in action. We've picked up on it so many points this morning about where we meet people, where they are at, where we identify those gaps in policy area that then comes down and becomes a reality in navigating systems. The expertise, the insight of the sector is all there, but we need to understand that ecosystem collectively, more effectively. So when we talk about supply, I don't like the term supply for our sector, because actually when we talk about social prescribing, what we really need is more community development work and people on the ground who are working alongside people to generate activity. It's not a system of supply, it's a system of empowering people. And so we really want to invite a conversation that's centred around that question, but then allows us as system partners to explore how we drive that forward and what that looks like. I think there's lots of learning as well, and I want to touch on the fact that we don't stop much. So in the voluntary sector, stuff does get stopped all the time, and it's heartbreaking. But there's so much learning. There is so much learning about things that have been stopped prematurely, things that need to be stopped that haven't been. So we have to look back in order to kind of work out the best ways forward and how we rationalise. And I think the final point of doing some really good development work that's focused around this question is that point of alignment. And it keeps coming up. It keeps coming up, the alignment between hyperlocal geography, neighbourhoods, place, South Yorkshire. How does it all interweave? And the alignment between those different services, opportunities. I think, looking together and answering that question gives us a great opportunity to kind of hone in on those areas of tension or anticipate some of the alignment we might need to bring in initiatives in an effective way. So that's the opportunity. I hope that sounds exciting and something that you want to be part of. You'll see, next slide please, in the paper, we have invited you through the recommendations to get engaged with the piece of work about the investment funds, which is that's a live piece of work that will run alongside our wider development plan and answering that question. But we really invite you to that conversation. We anticipate we'll run a series of interactive facilitated workshops in order to get to grips with that question. But that seems to be the most sensible starting point.
Thank you. I'm conscious Helen's got a hand up and I would appreciate an indication. Can I just ask you a question based on what you just said, which might sound like a hostile question? I don't mean to be. It's meant to be an encouraging, helpful, how do we solve the problem question, which is in the context of what we've just heard and seen around the Pathways to Work Commission and the plethora of routes into a system that, frankly, confuse people quite often. You're asking, or collectively, the BCSE nationally asking for a £1 billion fund, which has the potential to pour fertiliser onto an already kind of quite diverse system. how do you suppose we do this in South Yorkshire in such a way as to absolutely utilise that on the ground expertise, which is vital to get this right, but not by just letting 1,000 flowers bloom and really kind of confusing the system? What's the answer to that question? And that's a question we have to ask ourselves, not just for the record. I'm not just putting up you, but like, from your perspective, what's the BCSE role in that? And I'll come back to you on that because that's a complicated question. I want to bring everybody in rather than prioritize my question. So it's great.
Thanks. Dead helpful. Two quick points. The shared investment fund thing. Well, why wouldn't we? 10 billion over 10 years is asking that much money. So there's a sort of yeah, of course we should go for it, but there's a bit of a sort of a chasing money versus sorting the principles out that you very clearly articulated. But yes, go for it. And then there's the sort of the geography thing, give and get from local. In all of this, let's do this, but let's not use the point of localism. Helen, I know you've nodded vociferously. My first point of call, I can't ask Helen what Helen thinks. Helen's nodding. So yeah, Sheffield would be in. Helen thinks Sheffield would be in, and we will be in. But again, just getting the geography sorted just needs to be done.
Helen, did you have? You got your hand up.
Yeah, and it sounds really bad, so I don't know whether what I'm going to say is something that's already been picked up, but I just wanted to come in behind the sort of idea of an investment approach. I know that it would need some work, but I do think that we're ahead of the curve on this. I mean, in Sheffield, Emma Latimer has supported doing some evidence developing work in the North East, which is very much based on the principle of investment into neighbourhoods and community organisations rather than commissioning and contracting. And I think that we've got some really strong examples of why that really does maximise the impact of what we do collectively. So I just want to support the kind of idea of, yeah, it will take some working through. These things are not easy, but I do think that we've got already got some starting points that we can build on.
Thank you. Questions around the room?
You'll know what I said, because it's always the same kind of thing, and you know when you've got a connection with Vanessa Parr-Boyland in Doncaster, but coming to Doncaster is on our understanding from Doncaster, things like community wealth building as well as different methods. We've moved more than £2 million into voluntary community space sector social enterprise over the last 3 years through and beyond COVID, through some really novel and exciting and interesting means. And we've got still on our task list to mainstream some of that funding alongside some of the core contracts anyway that we've got. So I think that as part of all this, come and check out what is happening in local places as well to ensure that it's well matched, learns best from, and doesn't go on top of or not take account of that.
Yeah, absolutely. If I can answer your question. I think the ecosystem that we looked at around Pathways to Work was very much about systems and pathways existing. It's not about prevention. So what the voluntary sector, the services and groups, but services and work that BCSE organisations do in neighbourhoods isn't on that ecosystem of a particular pathway that you need to go and be referred to. So I think collectively as a system, we talk about prevention. And actually, and I get it, it's very difficult to stop doing what we're doing to find the resources for actual prevention. And I think what we're saying is that, and I agree with you, Greg, the actual amount over the whole country, if you distill it down to South Yorkshire, a 5 billion, I'm not talking just about health and care stuff, 0.5% of that is 25 million, or we're looking at 1.5 million now across South Yorkshire. It's a tiny amount. It's a starting point. So what I would say is, we can talk about the principles and think about how the fund will align and ensure that it works alongside existing funds. But we don't really have any prevention funds. We have earmarked for prevention, and for me, it's a start in terms of investment.
I'm not 100% sure I'm convinced by that argument, simply because what you're saying that there's nothing at the moment, and we want to add to that system. And my question is, how do we do that in such a way as to make sure that it doesn't confuse those people who are the recipients of that system? And that is a question I think we all need to answer. I am genuinely not just putting that on the BCSE. We all need to answer that, and we need to do that in collaboration. And it should be one part of the system dominating that. I'm interested in that. I don't have the answer to that question. Sorry.
Yeah, so I think in answer to your question, I think the investment needs to go into the organisations. So if you think a community anchor working in a neighbourhood, and that investment can boost their capacity to do the right things in that neighbourhood. And that's what we need.
So I think we might need to be quite purposeful and intentional about how we spread that amount of money, which is pretty small. We might need to be quite specific about where that goes and look at what it does and what impact it has, and then think about that in our wider investment.
Well, this is a conversation we might need to have again.
Yeah.
It's a really rich thing. So.
I don't think it's possible to answer to those questions. Is our voluntary community sector organisations stitch together incoherent messiness across much of the public service, which just is. We'd love it to be all nice and neat and tidy, but the world isn't. So I'll channel my inner Matt Dean, who runs Zest. What Matt will say is, I will stitch together your leisure, parks, health, social care, employment skills across a whole bunch of different services. That's what they do, and they're really, really good at it.
I'm not convinced by that either.
No.
Honestly, I'm not. I think I'm happy to have this argument, but like, I'm not. We have to take some hard choices, and those hard choices will occasionally be how do we stop doing some stuff in order to make the money we do go further with a smaller number of organisations, and that is not a comfortable conversation for me to have, you to have, anyone else, and that's why we don't have anybody to feel comfortable now. But that is why this conversation is difficult, is because putting more money into a system and saying let the BCSE then kind of put that onto the ground and make it work doesn't help the person necessarily at the other end of this who can't navigate a system which is increasingly complex. And I think the public work is a real problem. Yes, really.
Well, I think my counterpoint to that is the voluntary sector are really well placed to help with that. So that speaks to that sort of yours work really counting, because they will have a lot of the answers to those questions or can help us with those conversations and working through.
Yeah, I think I can.
Thanks. So, I mean, just to pick up Karen's point, I do think this is exciting. So, you know, kind of, I think a big support of the proposition. Just taking a slightly harder edge, though. I mean, in terms of the shared investment funds, well, why wouldn't we do that? Why wouldn't we pool resources and try and get more out of the resources that we have? But the trick is in the plan, because at the end of the day, I mean, our interest as a partnership is to deliver the aims which are improving the health of people in South Yorkshire. So it's got to be investment for a purpose. It's got to be to deliver on aims, not just to do lots of really great things. And I think that so the trick is producing that plan, and the investment then is a second order question. It's about how do you enable the plan. I think the challenge though is, I mean, I've been on a little bit of a tour of VCS organisations, as you know, and actually the diversity of them is the richness, but it's also the challenge as well. So I think it's how do you keep that kind of agility and the hyperlocal and the very specific focus, whilst at the same time having a relationship with the VCSE that helps us to deliver our aims. So I think it's a really important proposal, really supportive of it. But there is that kind of, it's got to be for a purpose, which is linked to our aims.
So I can answer this question. But what I'm sort of hearing, I am a bit in the money chasing space here. There's an opportunity here, but I suspect a number of regions are also sort of having conversations about, and therefore, and we are well favoured and well placed, but we need to be agile in the space while having that conversation. And I'm just keen to understand what the practical steps are to actually position ourselves, because we shouldn't be chasing money. My head's spinning in terms of a number of things I think we could match against that. Love to be involved in that conversation, but I'd like to understand what we've got to do practically to sort of bring ourselves together, to convene ourselves, to sort of chase that catch.
Okay, I join then.
I'll just walk in at
Still got to learn the signals, it turns out. Can I come back to you guys?
Well, yeah, on that one. So in terms of the potential funds that would be happening nationally, to be ready for that, we would need to be clear about who our local partners would be, whether there is a genuine intent to support the investment bit, which is about local match to leverage national match, and a clear kind of purpose around where we see some of those priorities, and really thinking through the governance of how that would work in an ICP space. So how would we co-design that with our voluntary sector partners and our communities? whilst ensuring that it's a vehicle that would be attractive for all of our local investors as well. And that's what we need to do.
Thank you. Karen, can I just ask you, in terms of the matching, does that have to be new money? Does it have to be money that's already? I'm just Rachel's comment about Doncaster sort of provoked me thoughts in my mind. You don't want to have to demolish what we've already got to put something new that might even deliver what we want to. So I understand the notion of match funding. I'm slightly unclear whether we have to find new funding to match with this, or whether we can use existing funding. And do we put that existing funding in terms of its current purpose at risk? If we put, it's very unclear. Sat here as somebody who's new to this, what we're actually being asked. Are we being asked to find new money as part of a matching arrangement? Are we allowed to put in existing spend as matching arrangement? Because clearly, if we can use existing money to match that, I'm sure from Stephen's perspective, that's a much easier.
Really over on Samson.
Yeah. Unfortunately, you're asking me a question that takes me into a report that I can't share the detail on. But what I would suggest is that I think it would be unlikely that nationally they would be proposing a way to find additional national funding to support funding that already exists.
That's your hunch.
That's my hunch. Yeah.
Okay. All right. Thank you very much. In which case, party members are asked to know the working progress of the BCSE. Consider their organisation support the scope of interest in and the governance of the South Yorkshire Shared Investment Fund. Consider their organisation's involvement in development of the system BCSE plan to support transformation, and suggest key contacts from their respective organisations to support the Shared Investment Fund and South Yorkshire BCSE. We all agree. And thank you guys. And sorry if that felt like a more start set of questions that related to me. I really appreciate it. On to item number 8, please, which is the Cancer Alliance update, showing progress with the South Yorkshire Shares Up campaign and cancer strategy. That's going to be led by Julia and Liz.
Thank you. So, those of you who don't know me, I'm Julia Jessup. I'm the Director of South Yorkshire Cancer Alliance, and our leading strategy for cancer. So, Max, are you running the slides? Thank you. So, just to remind you,
it's up to you guys.
Now we just realise we need a cancer strategy for South Yorkshire because our outcomes are just not good enough. They are really poor outcomes. And as a cancer alliance, we cannot. We have to have a partnership approach. We need to do things differently. Change the outcomes. We want a strategy that isn't a plan and a package that's out of date, the moment it's finished. We want a living and breathing partnership approach to how we can all this together. So we were tasked by our mayor, and we had the support of the ICP to come up with something tangible, something that we can do that people can get behind, and what we're going to do to improve outcomes for cancer. So we started with the Shows Up. So Shows Up is our branding, and it's part of a social movement. And underneath that sits a tangible plan to do. So next slide, please. Max, thank you. So we started with setting some bold ambitions, and these are public health driven. So they are designed to be measurable and designed to really impact on the areas that are going to make the difference. There's an absolute golden thread there to the ICP for ambitions, and also in terms of the long-term plans. So absolutely shift from hospital to community, and very much a shift from the analog to digital. But what's coming through really strong when we're having conversations with our public and patients is it's a digital to digital just as much. It still feels really fragmented at the sharp end of services. And prevention, absolutely, but not just primary prevention, secondary, tertiary prevention. How are we maximising all of those life course opportunities that we have to intervene and really influence people using behavioural science, addressing inequalities? That's how we set our ambitions. Next slide, please. So just to share with there's some science behind the areas that we've chosen in terms of the focus for the first year. So a bit busy this slide, but what it's showing you essentially is part of our problem. We have got one of the highest rates of emergency presentations. And when you don't come in through a managed route, you have late stage so we tended to start as the Cancer Alliance from Paul. That's why it's not the partnership. It's much broader than that. How do we improve and how do we affect that life course that really changes the way that we behave in and how we're accessing services in the first place? Some of it is to do with improving the way that the services as they exist, but some of it is much broader. Next slide, please, Mike. The other thing that we know, and Greg will confirm this for us, is that screening works. So the purple bit at the top is the late stage presentation breast cancer screening, and it's against age profiles. The green bit at the bottom is at early stage. Over 90% of cancers across all ranges in breast screening are early stage cancers. It's about 60% in bowel, similarly cervical, and then with the case finding. So in South Yorkshire, we've been leading the way in some of the health checks. Recently gone out, and whether you showed up to the presentation that we had, to the rollout that we had in Sheffield, we have absolutely flipped late stage diagnosis. So 75% of lung cancers in South Yorkshire were stage 3 and stage 4. It is now through the targeted lung health checks, 75% stage 1 and 2. So we have totally flipped that. So screening works. Next slide, please. So these are the things that we've focused on in terms of tangible things that we want everybody to get behind based on our understanding of what's going to work next. I'm just going to hand it over to
Thank you. What we wanted to do as well is obviously we need to prioritise, can't do everything. The ambitions are ambitions long term, and think about what do we do first, and also recognising it's not about duplicating work that's already happening, particularly as we're taking such a partnership approach and working in place. So we need to recognise there's a lot of work already happening, but where are those areas that we do need to focus on in the first instance? So as Julia's alluded to, we know there's a lot of obviously work happening around screening programmes. There's more yes we can do in terms of access, but actually what are some of the things that we maybe haven't put as much time and energy into, and other partners that perhaps we haven't worked with as much from a cancer perspective, who are really important in helping us move things and change what we're doing. So really interesting in particular, this year we're working with employers far more and started to do that and have a very different conversation about what does it mean when you've got people having diagnosis, going through testing. What does it mean when people are away from work, but also even how do you get people returning to work in the best way that employers can support people returning to work. And it's opened up a lot of really interesting conversations about recognising the role of employers in supporting people. And we're starting to work with kind of kite marking approach to saying if we have a kite mark that looks at what is the sort of best practice, what are the things that employers should be doing to think about how to have conversations about cancer, but also then how do you support people going through cancer and returning people to work. We've also started to work with other sort of partnerships around this and looking at information that's already out there and how do we make it more sort of local and meaningful to local people. We started to build on the work around prehab and rehab, the Active Together work, which I think many people are familiar with. And so we've got a really good foundation. How do we build on this? We now have a commitment to develop it further, not just from a cancer perspective, but potentially thinking about what is the offer for anybody wanting surgery around prehab and rehab. And that's potentially where we could go with this model across the whole of South Yorkshire as well. So that's something we're starting to really develop and take forward this year. I think the final area, which we recognise we had a lot of feedback around, was The bold ambitions make sense. People can sign up to them. There are things that are already in place, but actually, where is the kind of investment from a financial point of view? We may need to think about, particularly around capital. And I think that reflects the whole conversation around sort of out of hospital, what will be delivered nearer to home or at home. And you look at some of the ways services are starting to shift, and some of the, again, a place, some of the plans people have got, whether it's kind of like that hospital on the high street, kind of philosophy, what is the role and what do we need to do from a capital investment point of view. So we've started to develop a piece of work on that, linked to thinking about workforce as well. So if we just go on to the next slide, as Julia said, we are really conscious of this not being something that's just a plan on a page. It is about how we create social movement around this. We know we need to keep developing, we need to keep talking about this. We've developed a website where we started to populate all the examples of what's happening at the place, different activities, different initiatives, starting to show what people are doing in different areas. We have an incredible People Affected by Cancer Advisory Board. This is just the most incredible group of people who we meet very frequently. We're there with them this week talking about the 10-year plan, who are real ambassadors for what we're doing. They're taking part in films. They are promoting the work that we're doing. They're really supporting what we're doing. We're doing a lot of engagement events across the whole area, road shows. We are really thinking about how do we as well think about how do we deliver more personalised services and approach to cancer services as we go forward as well, and linking into the personalised care strategy that's also been developed. So this is just a moment in time. Wanted to come give you a sense that this is what we're doing. There was real momentum around this. As you can see, we've got resources, branding, so people are really clear when they see something, they know it means it shows up. We're doing campaigns with schools. We've got young people involved in developing the materials, how they see cancer, what they want, where they actually access information, which is surprisingly it's not necessarily in the classroom. So we're thinking of how we best do that, and got some really committed people who are working together on this. So we just go to the final slide. I think today it was just that opportunity to give you the update. This is what we're prioritising. Any events, road shows, meetings you would like us to come to, any connections perhaps we haven't made, happy to make those. And if you want to get involved in being in a video, kind of ways, supporting this work, the opportunity is there.
Perhaps we just send you a more updated photo. That's a random suggestion. Thank you for that, that's brilliant. And the long stuff you took that. I've got Angela on screen as far as I can tell, and I've got Ruby.
Yes, thank you very much for that. I was wondering whether we are benchmarking. It's great, and you know, it's really good presentations. It's really good to see the progress. And if we are benchmarking how screening is currently for minoritized communities, and if we're going to look at what outcomes are going to be like, you know, in the long term for minoritized community, just in terms of equality, and I know that the data is not always there, but if we could sort it out from the outset, how we collect data, it might help us understand how different communities are affected, or, you know, not necessarily adversely, but how, you know, the screening works, but does it work for everybody?
Thank you.
5 quick thoughts, pick up on the mouse side. On incidents, much more to do on alcohol policy, air quality, obesity-related stuff, tobacco's going the right way. Screening and staging, declaration of interest, National Screening Committee member. I don't buy the validity of the route to diagnosis and staging. Well, I do buy it, but it can be too easily used as a stick to beat people. You'll do better. Screening does harm. We should never ever forget that. You know this. Only National Screening Committee approved programme. Let's have a conversation about PSA testing in men at some point, please, because we'll do a lot of harm by getting that wrong. Equity and coverage, it's the Commissioner's responsibility. dear NHS England, you are the commissioner, you need to sort this. Community champions, etc. A controversial point. I'm not wholly convinced about the city centre diagnostic thing from a cancer outcomes, or from a diagnostic outcomes perspective. I am convinced from a football perspective, but from a health outcomes perspective, I refer you to the York Centre for Health Economics thing that was done 2 or 3 weeks ago. It was a bit equivocal, to be honest. That's a controversial point. Last controversial point. Multi-cancer detection tests, no, don't go anywhere near it till we've worked out the evidence on that one. And there are difficult choices to be made about cutting edge life science versus opportunity cost. How many lines of immensely expensive biologics do we give to cancer patients? That comes at the opportunity cost of stuff that we could invest in. Well, you said, well, that's not your list on that, but there's some very, very, very difficult choices to have in that space.
Hard choices. Absolutely. Would you mind sending that report around? I'll be happy to about the CDC. I'm sorry, that because you might send it to.
So just in terms of screening, yeah, absolutely. We have lots of information on screen. So we are able to tell you in each of your places which are the communities that are not taking the screening opportunity. And we're trying to map that to, and does that link to a late stage presentation? So where have we got the missed opportunities? So the idea is that we're working through place, and it's building on the bits that we know work. So we'll be working collectively to say these are the communities that we need to increase. That's where we're getting the public health. And Greg's comment, yes, we work with you, Greg, as much as we can to make sure that everything is done through that public health lens. We have a national programme that gives us lots of money to try and deviate from the screening programme, but we always make sure we talk to you.
Good. Okay.
I think you just no. I think you had some.
All right, thank you. And thank you guys. I'm conscious we had a conversation about cancer probably about a year ago, maybe a bit longer than that. And I was challenging you on some of this stuff, and it seems to me like you're really responding to that. So I really appreciate that. Thank you very much. Do you just want to put this last slide back on the screen so everyone can see what they're sorry.
I think it's more it's that update, and if there are any other opportunities that any other stakeholders we feel we can connect with,
okay,
particularly employers, that we really recommend working on.
Okay. So all of those things. So stakeholders, to champion the programme. So anything you can do if you can share with us anything you want us to share. So be it graphics or anything else on the end of emails, and tell us how you want to do it. And if you've got any best practice you can share, please do. And that would be really helpful. You know, I'm happy to do that. So I didn't promote it. There are specific things you want to put on my social media. There's been the same position organisation, if nothing else. And then let us know how you want us to participate in videos. Because otherwise we get a lot of bad TikTok people dancing. So let us know what that looks like and what that means and how to do it. I think we would all really need to support the work where we can in that. So, all right. Brilliant. Thank you. Thank you very much. Okay. On to item number 9 in that case, which is considering our response to the draft in the anticipated national and the health plan. It's going to be led.
I'd like to mention that the investigation into the thing and that you were in the kind of early stage of starting to really what these people so first part of it talks a bit about the broadcast report. I won't take you through this, but my individuals considered it in organisations and what I will say is that some of the key themes in there really resonate in South Yorkshire, and some of the things we've talked about today, particularly about the themes in the report around optimising the contribution that we can make in terms of social and economic development. We'll be focusing a lot of our time talking about so the next part of the paper talks about what we understand from the 10-year health plan. And this was a bit less clear last time we came together. So this bit feels a bit clearer now in terms of what the shape of that's going to look like. So what we understand is that there will be a series of vision and goals. So
thinking about how the NHS social care can be done when we need it, focus on the major pillars, so fewer lives lost from the big pillars, so that's kind of mentality and things that we know about earlier. The fair and better wearable lives for our lives, so that's thinking about the health and policy. So they really sit really well with our integrated care and approach that we set out in there. What we know is that that will be underpinned by a focus on health, a bit of a health mission, and that what we are expecting is that largely this in things that are within kind of health and care system, sphere of influence, and then also things more broadly, which will require a significant amount of cross-government work around the wider determinants. And then more specifically what we understand, we've already referred to things is that we're expecting the plan will focus on how it enables these shifts, hospital to home, and non-digital and treatment prevention. And again, our integrated care strategy and the work and plans developed onwards are there's work underway that's in line with that kind of direction of travel. If you go to the next slide, please. So in terms of an update of what we now understand about the opportunity to inform the 10-year health plan. So a lot of this has been led nationally. The national NHS change conversation commenced at the end of October, and I know through our kind of communication networks, we have shared the information in the activities portal. There are a number of ways that. So if you've had a chance to have a look at the portal, we can all contribute as organisations, we can contribute as individuals. There's also a kind of workforce section. From an organisation perspective, they were asking for input from organisations relatively quickly. So the timeline for that is actually early next week. In terms of an ICB input, and we'd be really happy to share that. In terms of individuals, we've got an opportunity to complete this for a little bit longer, so that's open for a little bit longer. And we've also very recently received the work from the ops materials, which is really a range of support as part of the conversations with that staff. And there is a further mechanism on the website to be able to complete that. There've been a range of deliberative events for our NHS leaders to be involved in those. ICB region. In terms of the South Yorkshire approach, as part of that response, we're absolutely ensuring that we are using and informing that with the insight. So last time we took together about the start strategy and the kind of involvement approach to that. So what and the work that we're developing in terms of development of insight now. So what we're doing is ensuring that we utilise that insight to really make sure that gets fed through into the national process. I'm also looking at how we work with our partners and networks to support people to contribute to that national process. One of the things that I was going to kind of ask you today is about our collective responsibility in that space, you know, in terms of supporting people to be able to be in a position where they can contribute to that. The last little bit there around the heart service was just like that there've been a number of conversations over the last few weeks that have been able to that part of engagement. So the national timelines are challenging. So we had a strategic discussion with NHS leaders last week, some of that output has influenced the shape of the input we've put together, and obviously today the shape of the conversations today as well. So the last slide, so this is just to share a little bit of a flavour, and I will circulate this has been work in progress whilst we've been putting together the pages for the meeting today, just to share a little bit of flavour of the ICB response in terms of the type of areas that have been articulated in there. So we've been looking at things like, you know, what we'd like to see in the plan in terms of positive framework, ensuring this purpose and people. So that's one of the things that's come through from a number of discussions, fits really well with our integrated care strategy. Working with citizens and thinking about how we work with the VCC sector, and again, that's something we're talking about today. Our ask in terms of thinking about kind of long-term financial planning and planning that supports that left shift, so that kind of greater investment in terms of primary care community. quite a lot in the draft response around public health and mental life determinants, very much in line with what's known as the care strategy and that kind of pro-equity approach that Rachel really focuses on last time when we were thinking about prevention, how do we do that with a pro-equity approach? And then also more emphasis around the opportunity we have to think about kind of economic development, which fits with what we talked about today, just getting that awful yes. So I'm really happy to share the more detail, but would be helpful to later.
Thank you, everyone. Thank you, Marion. I'm conscious that in South Yorkshire we have, as well as obviously this wider context to work within, we're also kind of talking to government clearly about the DWP work that we heard about earlier. We now have kind of developing a cancer strategy. There is the DEVO white paper, which will include commitments from the government on health, and the MCA in South Yorkshire is at the forefront of that conversation with the government about what health inclusion could look like. So I'm conscious there's all of that going on, and in South Yorkshire, arguably, what we do need is that 10-year plan that matches the 10-year ambitions and the government's 10-year ambitions. When you talk to someone like Alan Gilbert, it's very clear that Wes is thinking acutely about how you solve the problem of waiting lists. And he's also then thinking about how you use the space and political time that allowed, hopefully, to through that process to actually get a grip on those long-term problems. And how do we go to Wes and what it looks like in that 10-year long-term space about all the things we're going to do? And I think we have the bare bones of that already, quite honestly. That for me is the framework for this conversation. So I'm really interested in this piece of work from Does In, but how it fits in with South Yorkshire is the kind of key question on how South Yorkshire can fit in with.
I would agree that they've gone, but they're helpful. Thank you. 3 thoughts. One, I don't think social care reform is on the table. That's a deal breaker actually, because the NHS will try to hold pretty clearly on social care breaks, and it's just not on the table. So I think we've got to say that really loudly. Second, and I've said this to you, Mariana, if the NHS response to the NHS framing of the response to the 10-year plan doesn't speak very directly to the really blunt diagnostic from our class, don't bother. It just got to speak to overdiagnosis, overtreatment, that's where the business is. And bluntly, the resourcing of primary community care, which is going to fall over. And then lastly, on that health, 10-year health NHS plan versus health missions thing, I'm reasonably excited on what will come to the health missions, which will be long-term, cross-government, all that kind of stuff. How that ties up with health and wellbeing boards and all that kind of stuff. That's a sort of a not here, not now thing, but we can't forget it.
Other comments? Kate, sorry.
No, hi, no problem. My biggest concern really is the access to the high quality care that's obviously cited on there. What with 22% of providers looking to close the doors and 57% looking to hand back contracts to the council, that really concerns me about the frailty of the sector and the quality that's going to be left. They're getting squeezed more and more in terms of unit cost and what's able to be provided. I do genuinely worry about the quality that's going to be left. So as a provider in the health and social care space, I know certainly I'm under threat, and looking at the frailty of the sector as a whole, trying to recruit into it and trying to provide a good service, let alone an outstanding one, I really feel like your quality is going to be compromised.
On care, because care is a consistent theme, clearly and rightly, can I pose a controversial question, which is, could South Yorkshire come up with its own unique model that we could go to government with as a travel? Is that possible? I don't know the system well enough to know if that's a stupid question or not.
There was work done 4 years ago, the Bill Not Review, which looked like a modest, my words, but sensible way forward of putting us on a footing that looked as though it created equality and a financial framework that was helpful. So it didn't say, let's be clear, Bill Not did not say this is all funded by the state, but it limited how much individuals. The question you're asking is, could we do something like that and see if we could take that money in South Yorkshire and use it in a more coherent way? I don't know how up the government is for that, because I think they're trying to avoid this one.
I think they're trying to avoid it for obvious reasons. Multiple governments have there.
Oh yeah, all of them.
I don't know. It's a DAS social care provider question overlapped with the general policy local authority finances, which all of which is in the mix. But it's worth asking.
It's a stupid question.
I don't know. I genuinely don't.
Might be worth asking.
Yeah.
Sorry,
I think it's a legitimate question to ask, but I think it's said in the original about, and I think you said this before in your experience with government, is there are lots of things that the government is saying now where it wants to get to, but does not have to get to it. And that's our space really. If we can put forward propositions around investable propositions around how we reform this system and the work with that on the steps in housing as well. Definitely something in social care, but it's a partnership between us and government about system reform. That I think is the space that we should be. We've got to work out percentages and another one. We've got to work out what we spend our energy. We only have that.
And we have been invited by geological necessarily a kind of specific conversation about in terms of like we know exactly what it's like to have a conversation with the government about what public service reform might look like. And so actually kind of if that is a question we can ask, we should ask it. So Dillon brought down Theresa May, which is why politicians now struggle to engage this.
Andy Burnham was attacked by the Labour Party. To be clear, all parties were avoided.
We need to be brave in this space, and we can help the government solve some of these problems, can't we? I think potentially, and I think we should try and do that. We can, because I think the government do want to solve the problem, but see, try. We need to help them understand kind of how we can do that here, maybe first, either way.
Sorry, well, it was a sort of related question, really, which is, I mean, clearly individual organisations are responding, the public are responding. There's a question of whether we also respond to the partnership. Now, the timescales are ludicrous, but I think there may be an opportunity to speak directly, to go directly to Lauren Hughes, the civil servant who's leading this, and share our thoughts. Because the thing about Darcy, it's not a surprise. This is actually the space that we've been in for 2 years. We recognise these challenges, and that's exactly what we've been trying to move the dial on. We've got it in our strategy. So, I think there are some important points that we could make collectively as the partnership.
I agree, Kevin. I wouldn't oversweat the process. We all have into my waste but it's a mess. It's a mess. It's been driven really, really quickly. I think those civil servants are driving very much welcome private conversations. I suspect can't be that, but they've welcome private conversations about some of the. This is what we really. We said ex publicly, but this is what we really think.
Anybody else raising their eyebrows at me in a suggested fashion? Okay, all right. Thank you very much. That was a really good conversation. Did anybody fill in the change survey and tell West Street that they want to weather spoons in their local hospital?
I didn't think about that. I thought that was your suggestion.
Okay, so we are asked to consider the initial analysis of the Darcy report, note the update on the National 10-year health plan, and anticipate 3 shifts. The ICB is developing a response and contributing to a new NEY ICB response, and that the portal is open to all organisations. The deadline for organisational submissions, as we heard, is 5 p.m. on the 2nd of December, and then consider how all partners through their networks can support the message that there is a national survey to reach out. So I would agree. Thank you very much. Okay, we're handing over to Mariana again, the ICP operational group feedback. I should just say I've got to be on board about that. I believe this will be here for me. So it might be better to drop out and pass it to you.
If you use them, so the first one is about the opportunity. So remember the development essentially agreed that got a initial as in terms of reference mention. We've got the work that we do next to health and reports, which is that's the actual shape. You have got a bit of view of thinking about roles, perspectives that might be useful to have here, who we don't have, what we want to strengthen. And I think that was kind of thinking about the VCC from the CYA perspective, they were similar. And then you've got a bit of a proposal of next steps around the plant themselves, the ICP, we can take that forward. But what we want from you guys is, I suppose, a steer in support. For anything that you think that we have captured in terms of roles and perspectives that you think we need to think about, and just to make sure we've got things right with respect to your health and wellbeing board nominations. So that's the asking around that one.
Okay. Any comments, questions, suggestions?
The second one is about forward plan. So another area of action from the development sessions that I understand forward plan. So what you have in there is a forward plan for the next few meetings. So when we come together in January, we'll focus on workforce and that space, workforce and its wider sense. And then when we come together in March, we'll focus on CIP. And we will start at the operation group start and what that but we'll just put that one, let's try and build that connectivity. You support us to drive that forward.
Any comments, questions on that?
No, that came from the Health and Wellbeing Board who wants to see a forward plan. If you remember, that's a response to their environment.
To share that, I've got that. And the third bit is about strengthening the lived experience element. And I think, the last couple of meetings we've been trying to do that, be able to see that in person and things like that. The other specific bit of that also is looking at how we develop our approach to feedback and connecting that with how we focus on each one ambition. Do we take an approach that also looks at what we like feedback, thinking about you said we need to approach. Now it takes time to get it right, but we felt like that was help us start to think about building this cycle.
Can I make two small points on that? Or one small point, just on EDI, in the sense, as far as I can tell, I'm assuming there are two background minority ethnic community viewpoints take around the same, and that probably isn't good. And we've gone backwards a bit on it. So just if we could think about that and how we're going to not just think about the experience, but about some of the balance, that would be, I think, a welcome thought process. Any other comments or questions? Thank you very much. Okay, on to what it says here, concluding comments from you. Any other business? Okay. I don't have any much more concluding comments other than to say I thought that was a really fascinating meeting and there was some really kind of meaty conversations in there. And this is a space where we get to kind of explore some particularly challenging opportunities and ideas, and I really welcome it. So thank you very much, everyone. Particularly those who came for contributing so thoughtfully to that conversation. Any other business from anyone else?
Sorry, can I just flag to Save the Children organising a South Yorkshire Child Poverty Summit on the 17th of February in partnership with other local folks. So I'll try and get something and circulate it around membership. I don't think they confirmed venue or anything, but just so you're aware that that's happening.
Oh, thank you. Any other business? Okay, date of next meeting is next year. I sound listening. 30th of January 2025. So I'll see you all next year. Thank you, everybody.
Thank you.